Every 12 seconds, someone in America types red light therapy into Google. The promises are seductive. Tighter skin, painless joints, deeper sleep, superhero recovery. The sticker price, $300+ for a glowing plank of LEDs you hope will do all that magic. Before you take a match to your paycheck, let's see if those red lights actually work or just burn your hard-earned cash. Hi, I'm Alex Carter, science journalist and professional myth slayer, and in the next 30 minutes we're putting red light therapy under a microscope. We'll unpack brand new 2025 data straight out of Harvard and Mayo Clinic, prove 15 peer-reviewed benefits you can actually bank on, demolish 7 myths influencers keep feeding you, and reveal exactly how to use red light safely at home. I'll even give you a free interactive PDF that ranks the best FDA-cleared panels and shows how to save real money. Speaking of the FDA, quick reality check. Home red light devices are cleared only for 2 things: pain relief and wound healing. That's it. Everything else you hear, instant fat loss, miracle anti-aging, curing every ailment, is unproven hype. Results vary, and misuse can do more harm than good. You wouldn't swallow random pills without reading the label. Don't fry yourself with light without real science. Here's the roadmap. First, 60 seconds of plain English tech basics, no PhD required. Then, we sprint through 15 documented benefits: skin, muscles, sleep, mood, immunity, you name it. Next comes the fun part: myth busting. Hotter isn't better. Red light doesn't melt fat, and your panel definitely doesn't cure cancer. We'll wrap with safety rules, a cost-saving break-even chart, and a friendly, spam-free subscribe invitation so you never miss the next evidence-based biohack. Sound fair? Great! If you've ever used red light therapy, smash yes in the comments right now. If you're brand new, type no. Either way, keep watching, because by the end you'll know whether red light therapy is a legitimate biohack or an expensive money pit, and you'll have the data to prove it. Let's dive in. Red light therapy, technically called photobiomodulation, works by bathing your cells with precise, non-ionizing wavelengths of light. The sweet spot is 630 to 850 nanometers, long enough to slip deep into tissue yet gentle enough to avoid ultraviolet damage. Inside, every cell sits a powerhouse called the mitochondrion, and inside that powerhouse lives an enzyme named cytochrome C oxidase. Think of it as the spark plug for your cellular engine. When these red photons hit the enzyme, they knock nitric oxide off its binding site and reopen the floodgates for oxygen. Instantly, ATP, the cell's energy coin, spikes. More ATP equals faster repair, stronger collagen, calmer inflammation, and yes, less pain. Now notice what isn't happening. There's virtually no heat. We're nowhere near tanning bed ultraviolet. And there's no magical quantum woo either, just basic biochemistry confirmed in hundreds of peer-reviewed papers. But dosage is everything. Meta-analyses show the therapeutic window tops out at roughly 1 watt per square centimeter. Go hotter, and you risk cellular stress instead of revival. In practical terms, that means 12 to 15-minute sessions, 3 times per week, at a comfortable 20 to 30 centimeter distance from a reputable panel. Speaking of reputable, let's talk FDA. As of May 2025, home devices carry clearance for exactly 2 indications: chronic musculoskeletal pain and stubborn wounds that refuse to close. That's it. Any influencer promising overnight fat loss, effortless muscle growth, or a total cure for aging is selling hype, not science. That doesn't mean broader benefits don't exist. It simply means evidence is still emerging and regulators haven't rubber-stamped the claims. If you want the molecular deep dive, absorption spectra, cytochrome kinetics, biphasic dose response, scan the QR code now or grab the link in the description. If you're here for the rapid-fire version, stay put, because we're about to sprint through 15 concrete, measurable benefits backed by gold standard trials from Harvard, Mayo, and the U.S. Air Force. Quick heads up. At the end of this segment, I'll ask whether the basics made sense. If it's crystal clear, type "clear" in the comments. If you want more detail, type "details" and I'll drop extra resources in the pinned reply. Sound good? All right, let's light it up and move to benefit number 1, skin collagen. Ready? Here we go. Let's light the runway with 5 hard data wins you can bank on. Benefit 1, skin rejuvenation. A Harvard dermatology meta-analysis published July 2024 pooled 12 randomized controlled trials, 528 people. Shortwave red at 660 nanometers raised type 1 collagen density by 31% in 8 weeks. That's dermal biopsy, not Instagram filter. Translation: noticeably firmer, brighter skin if you keep the dose disciplined. Benefit 2, muscle recovery. In a double-blind Brazilian study, 40 elite cyclists blasted quads with 850 nanometer LEDs for 10 minutes post-training. Next-day soreness dropped 38%, and sprint power rebounded 8% faster. Weekend warriors won't match elite numbers, but the science says less pain and quicker turnaround are realistic. Benefit 3, joint pain relief. Mayo Clinic's January 2025 knee osteoarthritis trial recruited 120 participants over 60. Standardized 15-minute red light sessions cut pain scores by half within 4 weeks without NSAIDs. Radiologist confirmed reduced synovial inflammation on MRI. That's powerful news if stairs have become an enemy. Benefit 4, hair regrowth. Controlled studies of 650 nanometer laser caps documented an average gain of 17 new terminal hairs per square centimeter over 6 months. No, it's not a miracle toupee, but dermatologists consider anything above 10 hairs per square an aesthetic win. Consistency matters. 3 alternate day sessions were the sweet spot. Benefit 5, sleep quality. A U.S. Air Force Performance Lab trial exposed pilots to low-intensity red light 20 minutes before lights out. EEG readouts showed an extra 21 minutes of deep, restorative sleep per night. That's the difference between waking foggy and waking sharp. Of course, red light can't override doom scrolling at 2 a.m. Sleep hygiene still rules. Quick recap: collagen up, soreness down, joints happier, hair coming back, deeper sleep. 5 boxes ticked. 0 hype. Grab a sip of water. 10 more benefits are queued. Before we roll on, drop the number 1 to 5. That makes you raise an eyebrow. Skin? Muscle? Sleep? Type it now. Your comment boosts community data and helps the algorithm show this to more people who need real science instead of snake oil. Benefit 6, mood elevation. A 2024 placebo-controlled trial tracked mild to moderate depression sufferers using 660 nanometer panels over the prefrontal cortex. Brain-derived neurotrophic factor, BDNF, your brain's miracle grow, jumped 34%, and questionnaire scores fell by the same margin. Early days, but neurologists are excited. Benefit 7, wound healing. In a multi-center hospital study, diabetic ulcers that normally lingered 12 weeks closed in 7 under carefully dosed red light beds. Less open skin means less infection risk and fewer amputations. Life-changing stuff for a group often ignored. Benefit 8, inflammation reduction. Emerging 2025 data show C-reactive protein, the blood marker that screams inflammation, dropping 10 to 15% after 4 weeks of thrice-weekly sessions. That can translate to calmer joints, faster workouts, and maybe lower heart disease risk, though long-term studies are still underway. Benefit 9, cognitive clarity. Pilot trials at the Boston Memory Lab found seniors scored 11% higher on focus tests after near-infrared scalp irradiation. Not a miracle cure for dementia, but a hopeful nudge toward sharper mornings. Benefit 10. Immune support. Preliminary Mayo data hint at modest T-cell and NK cell upticks, about 9%, after regular sessions. That could mean quicker virus clearouts in theory, but we need larger cohorts before popping champagne. And here's the curveball. Harvard's May 2025 meta-analysis shows intracellular ATP surging 41% after just 8 sessions under controlled dosing. Energy is biology's currency, so a 41% raise is worth attention. 10 benefits in the vault. If you're still tracking, type "Got it" in the comments so I know you're awake and ready for the final 5 and for myth busting. Hydrate, stretch, and meet me in the next segment. Benefit 11. Athletic performance. Sports science trials from Queensland show competitive sprinters gained a modest but real 2% speed edge after 6 weeks of quad irradiation. 2% sounds small until you realize it's the difference between bronze and gold in elite fields. Benefit 12. Metabolic health. Early 2025 data out of Kyoto University tracked insulin-resistant adults using red light panels on the abdomen. Insulin sensitivity improved 14%, and fasting blood glucose fell 8 milligrams per deciliter. Not a diabetes cure, but a meaningful metabolic nudge. Benefit 13. Chronic pain relief. A 2024 multi-center RCT assigned lower back pain sufferers to red light or sham. The treatment group reported 40% lower pain scores and 30% less opioid use after 8 weeks. Pain specialists call anything above 30% a clinical win. Benefit 14. Post-surgery recovery. Orthopedic units at Johns Hopkins applied 850 nanometer pads to total knee replacement patients. Those who followed the protocol walked unaided a full week earlier than controls and scored better on range of motion tests. Less rehab time, less cost, less misery. Benefit 15. Vision support. We're cautious here, but a 2025 pilot suggests retinal cells exposed to low-level near-infrared resist photochemical stress. Early signals show improved dark adaptation in older adults. Larger trials are in flight, yet ophthalmologists are intrigued. That closes our 15 benefit ledger. 15 wins across skin, muscle, pain, sleep, mood, metabolism, and more. Confetti, boom, we're done. Now, let's talk myths, because YouTube and TikTok overflow with bad advice. Myth 1. Red light melts fat instantly. Reality. Meta-analyses show zero lipolysis without caloric deficit and exercise. Calories in minus calories out still rules biology. Myth 2. Hotter equals better. Anything beyond 1 watt per square centimeter or 42 Celsius flips benefit into stress. Visual cue. See our distracted boyfriend meme. Hotter is the wrong girl. Myth 3. Red light cures cancer. Hospital photodynamic therapy fuses chemosensitizing drugs with precise medical lasers, totally different ballgame from home panels. Myth 4. Red light replaces exercise. Benefits plateau if you stay sedentary. Mitochondrial stimulation doesn't override cardiovascular demand. Treadmill emoji reminds you, keep moving. Myth 5. Overnight results. Clinical timelines average 8 weeks. Collagen needs time. Mitochondria need repetition. Hourglass flips to calendar. Patience is part of the protocol. Myth 6. Any panel works. Quality varies wildly. Irradiance, wavelength accuracy flicker. Choose an FDA-cleared device or verified third-party lab results. Green QC stamp only for legit panels. Myth 7. Universal cure-all. Scope remains limited. FDA says pain and wound care. Everything else is emerging, not gospel. If one of these myths just imploded your assumptions, smash "fact" in the comments so we can see how many myths we vaporized today. All right, hydrate again. We'll wrap up with safety rules, a cost-benefit roadmap, and your subscriber bonus coupon in the final segment. Before you rush out and buy the brightest panel on Amazon, let's lock in safety. First, eye protection. A $10 pair of blackout goggles keeps photophobia and retinal stress off the table. Second, if you are pregnant, on Accutane, tetracyclines, or any photosensitizing medication, hit pause and talk to a clinician. Third, keep power below 1 watt per square centimeter. More juice flips benefit into oxidative stress. Fourth, remember heat. Anything above 42 Celsius can denature proteins. Use a cheap infrared thermometer. $15 could save your skin. Now, what about cost? Mid-sized FDA-cleared panels average $350. Clinic visits run $80 a pop. 2 visits a week? You break even in 5 weeks. On screen, you'll see our 3-year break-even bar chart. By year 2, the home panel wins by a mile. And by year 3, the savings rival a decent vacation. That chart, plus a ranked list of FDA-cleared devices, lives in the free interactive PDF linked below. Find today's deep dive valuable? Tap subscribe. No spam, just evidence-based hacks that respect your brain and your wallet. Early bird subscribers also get a first dibs coupon to our upcoming mini-course, plus access to live Q&A sessions. Next episode, we're plunging into 30 seconds of ice water, yes, cold plunges, to see if they really spike dopamine and metabolism like TikTok claims. Ring the bell so you don't miss it. Want your voice heard? Vote in our Community tab poll. The topic with the most votes becomes a future episode, and I'll shout out the winning voter by name. I've also pinned a Q&A comment below. Drop your toughest question within the first hour, and I'll heart your reply so you know I saw it. Ready to save money and glow smarter? Type "READY" in the comments. Download the free interactive checklist and share this video with a friend who's about to overspend on flashy LEDs. Thanks for glowing with me. See you in the comments and in next week's icy adventure.